Thank you. The honourable member for Olds, Didsbury, Three Hills, followed by Sherwood Park.
Thank you, Mr. Speaker. Back in March, I asked a question on Lyme disease where I addressed the chronic lack of support Alberta Health Services provide to Albertans with this serious disease. Lyme disease is a tick-borne disease and when left untreated has serious long-term health effects. Albertans have been contacting my office in desperate need for support, testing, and treatment. Will the Minister of Health apologize to Albertans for failing to ensure they have access to testing and proper treatment?
Hear, hear. The Honourable Minister of Health.
Well, Mr. Speaker, I thank the honourable member for the question. I know a number of colleagues on all sides of the House have been contacted by constituents about testing for Lyme disease. I can tell the honourable member the same thing that I told him the last time he answered the question. The testing for Lyme disease in this province is consistent with best practice and clinical evidence that's available globally, Mr. Speaker. I recognize that Albertans who may feel they have been bitten by ticks are concerned about Lyme disease. My best advice is to contact their physician or other health professional and receive.
Thank you. For a supplemental.
Thank you, Mr. Speaker. Given the amount of emails and phone calls I have received from my constituents and all Albertans across Alberta, it has become evident that some healthcare professionals are refusing to test for Lyme, and this government is forcing Albertans to pay out of pocket and travel out of country for very costly treatments. To the same minister, what progress has been made on this file since my last question, and will you today commit to meeting with myself and concerned families and patients?
Honourable Minister.
Well, thank you very much, Mr. Speaker. I would certainly be very surprised if any Albertan could say they were refused testing for Lyme disease in this province. Mr. Speaker, there are tests that are delivered in the United States, tests that actually I'm advised by the Chief Medical Officer that do not adhere to the same standards and do not rely on the same clinical evidence that Canadian tests provide. And I know that some patients have requested to receive the American testing. But, Mr. Speaker, I've been assured by the Chief Medical Officer that the tests that we deliver in Alberta are consistent with the current clinical evidence and best practice.
Thank you. Final supplemental.
Thank you, Mr. Speaker. I can refute those comments because I have testimony from patients right here that have been refused. Given this is clearly an issue affecting many Albertans, and given other governments, both federally and provincially, are already considering legislation to develop broad-based strategies to deal with this problem, when can we expect this government to follow suit and develop a made-in-Alberta solution that ensures we are doing what we can for people suffering with this terrible, debilitating disease?
Hear, hear. Honourable Minister.
Well, Mr. Speaker, I'm not sure if the honourable member wants to talk about testing for Lyme disease or the treatment of Lyme disease. If he has information that suggests that anyone in this province has been denied tests that are funded in our province under the Alberta Healthcare Insurance Plan for Lyme disease, I'd be very happy to receive his files and to talk to him about those instances. But, Mr. Speaker, I repeat again that we make decisions in Alberta about the health services we offer based on current and best clinical evidence that's available. I take advice from the Chief Medical Officer in this respect, and I am very assured that Albertans have access, as I said, to the current and best tests.
Thank you.